Hi, everyone. Welcome to today's webinar. This is Allie Cannington. I'm the statewide community organizer for the California Foundation for Independent Living Centers. I have the honor of working with advocates and organizers around the state to advance independent living and disability rights. I run the Disability Organizing Network, and we are proud members of the California Aging and Disability Alliance, which you'll hear a little bit more about today. I also I introduce myself with my gender pronouns. I use she and they pronouns, and I'm so happy that all of you have joined us from wherever you are in the state. So why are we here? We're here because there are more than 8 million people with disabilities and older adults in the state of California who we are like deep, rich, important parts of our state, our society, our communities. And yet, still to this day, we experience so many barriers, regardless of different kinds of disabilities. We experience barriers that prevent us from having the most choice and options for having what we need to live in the communities and have the jobs and the families and the lives that we want. So I just want to, and I'm sure all of you around the state joining us today know about the current inequalities that we're facing, people with disabilities and older adults. And today, you have joined the Disability Organizing Network and few other leading grassroots organizations, including Hand in Hand, the Domestic Employers Network, as well as United Domestic Workers Union. We're here to talk to you about some of the efforts that we've launched to expand California's long-term supports and services for people with disabilities and older adults. So as you know, there's more than 8 million of us around the state, and then even more millions of us who have a stake in our lives, who are deeply connected to the quality of our lives and you know, the deepest lesson in all of this is that we all need each other in order to live the most free lives that we want. So today's webinar is going to be a conversation with a dynamic panel of folks that I have the honor of helping to facilitate today. And this panel is going to discuss one of the many efforts to expand California's long-term supports and services. You will also hear throughout today's webinar the acronym LTSS, and that just means long-term supports and services. And we're going to go into a little bit about what that means in a few minutes. So by the end of today's webinar, we hope that you will learn about what we mean when we say long-term supports and services and how the California Aging and Disability Alliance is working to expand LTSS across the state. We also hope that you will take away how the work that we are doing through the California Aging and Disability Alliance, how it connects to the broader efforts to expand LTSS around the state. And lastly, we need each other, right? So we are hoping that today will be just the beginning of you joining us, whether it be joining us through sharing with your community or joining us to tell a story or attending our grassroots events around the state. We want to share with you ways that you can plug in. So lastly, I want to do a few things. One is I want to describe the slide that is in front of you if you are logged onto the computer. We describe slides and images to ensure that our community members who are blind or low vision have equal access to the webinar. So the first slide that you have in front of you says expanding long-term supports and services. There are a variety of images that are under the words, and there's images that have different people with all kinds of disabilities, some that you can visibly see, for instance, wheelchair users, as well as some that you can't see. So we have people also using different forms of durable medical equipment or assistive technology, ranging from a computer screen to a car, to a manual wheelchair, a cane. And then we also have the pictures below are range from people of all ages and all races. And lastly, underneath the photos, we have the logos of the leading grassroots organizations, a part of CADA, the California Aging and Disability Alliance, and these are the co-hosts for today. It's the logo for Disability Organizing Network, Hand in Hand, the Domestic Employers Network, and UDW, the United Domestic Workers Fighting for Workers in Our Communities, AFSCME Local 3930. We have an amazing panel ahead. We have today Christina Mills from the California Foundation for Independent Living Centers. We have Amanda Ream from UDW, Home Care Providers Union, AFSCME Local 3930. We have Monique Harris with Hand in Hand, the Domestic Employers Network. And we have Eli Gilardin from the Marin Center for Independent Living. Before we start with Christina, who is going to give us really a foundation of what we mean when we say and talk about long-term services and supports, or supports and services. We would like everyone to participate in a poll. So this will help us get an understanding of how you currently understand LTSS to be. So the poll reads, I believe long-term services and supports include, and it says number 1, caregiver personal assistance services, 2, assistive technology, 3, home modification, and 4, care coordination. So if you can, please fill this poll out, and Megan will read the results, and then we will pass it over to Christina Mills.
Great, thank you, Ali. And you guys are quick. The results are coming in. We've got 46 out of 69 people have sent in their answers. I'm going to give you a few more seconds. Okay, I'm going to go ahead and close the poll now. And our results are the majority of you agree that LTSS includes caregiver and personal assistance services. 94% of you answered that. 90% of attendees answered that LTSS includes care coordination. 77% of attendees indicated that it includes home modifications. And 75% of respondents indicated it includes assistive technology. So I'm going to go ahead and turn it over now to Christina.
Hi, everyone. Thank you, and welcome to today's webinar again. Ali, thank you for setting the groundwork for today's webinar, and Megan for showing what the results of the poll are. I have to say that I'm finding it very useful, and I think it serves the intention that we expected to see, and why we're doing today's presentation on what is long-term services and supports. So long-term services and supports, just a couple weeks ago, I was doing a presentation out in the community, and we asked a similar question about whether or not people thought long-term services and supports was more than just caregiving or personal assistance services. And a lot of the folks in the room said, no, they also believed that that was what LTSS is. And I had to challenge them for a moment and said, do you think that people that need caregiving or personal assistance also, or majority of the time, need assistive technology or home modifications, or maybe Meals on Wheels or care coordination, other types of services? And they said yes. And I said, so why wouldn't that be a part of long-term services and supports? And I think there was a light bulb moment and people realized, you're right. If people need personal assistance services, they likely need some other form of long-term services and supports as well. And so it brought me to, the foundation of what independent living is all about, and that is personal choice and being able to live life as independently as a person wants to. And a lot of that is because folks are choosing and navigating the LTSS system to get those needs met. So about 2 years ago, or I guess a little over 2 years ago now, CFILC was one of many, and I think we're now over 36 different organizations, a part of the California Aging and Disability Alliance. And we came together because there's a need in California, and there's a need around the country. And fortunately, California is proactively looking for solutions. CADA is one of those groups looking to figure out what are the ways that we can help fill the gaps in long-term services and supports for Californians with disabilities and those in the aging community. And quite frankly, if LTSS expands in the way that we'd like to see it expand, it might also provide a lot of services and supports to people in the middle class that don't necessarily have a disability or are in the aging population yet, but will be able to benefit from these services if we are successful in our community organizing and advocacy. So what I should start by saying is that there's a lot of myths out there around what the purpose of CADA is and what CADA hopes to accomplish. And one of the things that I've heard consumers say that I've hopefully been able to get them to understand is not true is that we're not trying to limit or get rid of in-home support services. In-home support services is a very critical program to many people with disabilities in the aging community in California. And I know personally speaking, as a parent with disabilities and children with disabilities, the IHSS program has been very critical to my family. So certainly we don't want to eliminate that, but we want to expand what is available and look at other ways to educate folks, the community, policymakers, and everyone as to why LTSS services are so important and what are LTSS services. And so a lot of people will say, well, my Medicaid or my Medicare, when you age into that system, covers long-term services and supports. And that's another myth. Do you consider what Medicare or Medicaid provides as the utmost best opportunities for you to be able to access long-term services and supports needs? Because I know that many people feel like what they're receiving under those programs is not enough, and there's still a lot that needs to be done. In addition to that, there's a lot of folks, especially folks with disabilities who are working, that don't qualify for those services. And there's lots of folks that become disabled or age into the community that don't qualify for those services unless they spend down their income. And really what CADA is trying to do is we are trying to figure out what are the LTSS needs in the community for folks who are aging and disabled, but also how do we make sure that those services can be available to people, not just based on their socioeconomic status. So we want folks that, I'll take myself as an example. If I, for some reason, had to stop working tomorrow and go on to benefits, I would have to spend down in order to qualify. Would I then qualify for IHSS? Not necessarily, but I could qualify for maybe some of the Medicaid services available. Now, I have been working and making, above the, the Social Security gainful income amount for quite some time. And yet, because I have a pre-existing condition, I also can't purchase a long-term care benefit for myself and for my needs in the long run when I retire, or hopefully get to retirement. So I'm sort of one of many people in the community that is stuck between a rock and a hard place. And so we want to make sure that people, whether they work, don't work, whatever their income level is, that there's LTSS services for an array of purposes and for a larger population. And so one of the successes of CADA just a couple months ago when the state budget was signed is that we advocated for an actuarial study of $1 million to be passed and signed by the governor into the budget. And that was a successful advocacy campaign that hopefully is going to help us understand what are the LTSS needs, including caregiving, home modifications, what are the other services that people need in California that should be covered under a long-term services and supports benefit. So the other things that I want to talk briefly about is CADA isn't the only group really taking on this effort. I'd say that CADA is certainly the primary group working towards figuring out maybe what the benefit should be, the structure of the benefit, and how to possibly finance the benefit. We have yet to get to that portion of our campaign at this point, but there's also a lot of other stakeholders in the community that are working towards better and more robust long-term services and supports. And some of that effort is being seen through what we've now had the governor put out through the executive order on the master plan for aging, and seeing that people with disabilities were included in the language of the master plan was very important. CFILC and a number of other disability organizations played a role in making sure that disability was one of the areas that the master plan did cover. The California Collaborative is working towards also better LTSS services. So is the SCAN Foundation, which held yesterday a briefing in the Capitol on what some of the priorities are from a community, from individual standpoint around the state, and what they would like to see as better long-term services and supports. And I'm not sure if they've published the survey results online yet, but I'm sure they'll be up shortly. It was not entirely surprising to see some of the priorities that individuals, consumers around the state really want to see as a part of LTSS in the future, like affordable, accessible housing, those sorts of opportunities to stay in California and be able to live a quality of life that includes dignity and self-direction. There's a number of organizations that are also a part of CADA. I'm not going to go over each one of them, but I also want to point out that the issue of LTSS today is so relevant and so important, and the advocacy and community organizing being done on this topic could not be done at a better time. I've not heard in the Capitol. I've been working in Sacramento for over a decade now, and never have I heard so much consistency from legislators and policymakers themselves saying, I don't know how to navigate the LTSS system for my parents who are aging and need services. Or folks that are realizing that their children with disabilities are going to grow up and are transitioning, and what LTSS services might they need or have available to them. So I really do feel like now is the time to really make a difference in this subject. And I think that when we see both consumers, legislators, service providers, and organizers working towards a common goal to expand and provide better and more equipped LTSS for the future, we're headed in the right direction. And I hope that helped lay the groundwork for what we believe long-term services and supports is. And I will end with just saying that independent living centers have been around for over 40 years. And many of you know that the first Center for Independent Living was established here in California. And many, if not all, provide LTSS services. So think about what services independent living centers provide and how those systems how those services have helped folks, maybe even some of you, get the long-term services and supports needed to live in your own community and home. Thank you.
Thank you so much, Christina. This is Allie again. Before we turn it over to Amanda Ream from one of our partnering organizations, UDW, I just want to kind of summarize, Christina, I think that, I so appreciate you kind of dispelling some of the myths around what we mean when we say long-term supports and services. And for me, as someone with multiple disabilities, both physical disabilities and mental health disabilities, I didn't even realize that I rely on LTSS every day in order to live the life that I have. And so as an overview, LTSS and how we're envisioning it is that it is really anything that people with disabilities and older adults need in order to live in the community and have choice around the ways that they want to live their lives. So that in summary can range from anything from personal care attendant services, caregiving, to durable medical equipment, home modifications, care coordination, Meals on Wheels, support with paying bills, some complex care, and we think about even that can range from support with transportation, anything people need in order to live in the communities with choice. So with that, I also want to say that with CADA, the California Aging and Disability Alliance, I will share, our members, the members of CADA range from AARP California, Alzheimer's Association, California Alliance for Retired Americans, CalPACE, Caring Across Generations. The list is long. It's about 20 organizations, and everyone who registered for this webinar, I will send key documents for you to review what CADA is and all of our members. I want to, and of course our members include our co-hosts for today, Hand in Hand, the Domestic Employers Network, and UDW. So with that, I'm going to pass it over to Amanda Ream with UDW to share how the work of CADA connects to in-home supportive services.
So thank you so much for inviting me to be part of this important webinar. My name is Amanda Ream, and I'm the research director from the United Domestic Workers Union. We're a union that represents 100,000 caregivers and providers of IHSS services in California. And I'm going to speak briefly about the status of the IHSS program right now in the state of California. The primary goal of our union is to strengthen and expand the IHSS program. We were part of the founding of the program, and I can say that it's when you travel the country talking about LTSS, all around the country, people say, I'd like to have a program like IHSS. So we're very proud of it, and we're very proud of what's offered in the program, and we know a lot needs to improve. We're part of the process of constantly trying to strengthen and improve the program. So top item for us is securing consistent, stable funding for the program. So I know many of the people who are participating today have been part of efforts to fight for year after year stable funding for the IHSS program. We had an important victory this year with Governor Newsom. Governor Newsom restored the 7% cut to IHSS. There was a 7% cut, and he committed to restore those funds to the program. But this is a temporary fix. And I want to speak briefly about what the program looks like right now and why Governor Newsom, we think, agreed only to a temporary fix. IHSS is a program that has grown dramatically since it was first started. It's grown more than 30% in the last 10 years, and we're expecting the program to double. Why will the IHSS program double, both in the number of people who participate in the program and in the cost of the program? It's because our state is facing a boom in the number of people who are becoming 65 and older. The number of seniors in our state is expected to double by 2030. And so that means we have many more people facing aging in place, facing conditions, health conditions and other conditions where they want to access in-home care. They want to access the IHSS program. Now, something that's a particular dynamic that we're trying to address with our policy efforts is there are many people in the state who don't have the means to plan for that last year of their life when most of us need access to home care. So they end up spending down their resources. They end up taking whatever money they have and having to spend it down so that they can become eligible for the IHSS program. Now, of course, we believe that IHSS and in-home care should be available to everyone, but we're concerned about this group of people who might be able to afford some care for that year, 2, 3 years that they might need towards the end of their life, that by entering the IHSS program, that's expanding the cost of the program. It's one of the fastest growing parts of the Medicaid, Medi-Cal budget. And we want to address that group of people and provide more options for them. So while we know we need IHSS to be strengthened and we need LTSS supports and services to be available to more people, we're specifically targeting coming up with a solution for that group of people who may be able to afford access to some care, but right now there's really no option for them to do so except to take whatever resources they have and spend them down. So one of the goals of our work is to bring together the aging community and the disability community to take a hard look at the IHSS program, to protect the IHSS program by creating more access to services for more people, to alleviate some of those pressures that are being created on the IHSS program as we look to the next 10, 20, 30 years. We really want to stabilize the program. We really want to expand the program, and we want to make sure that it's here to stay. And one of the chief ways that we think we can do that is by creating access to long-term supports and services for more people. So the IHSS program doesn't end up being the last resort for so many people. So I hope that was helpful, and I know we're going to have questions later, but I'll turn it back over to Allie.
Thank you so much, Amanda. This is Allie again. I just want to go ahead. I'm going to describe your slide. So the slide that Amanda was speaking about is right in front of you, and it has a graph that a line graph that shows the growth of IHSS in the past 20 years. And it says IHSS caseload has steadily increased over the past 20 years. There's also, next to the graph, there are two statements. One is IHSS is one of the fastest growing programs in the state and will likely double with the aging boom. And then below that, it says Governor Newsom restored the 7% cut to IHSS for next year, but as the fastest growing budget item in Medi-Cal, IHSS is likely to be targeted for cuts in the years ahead. So, and then below that, it says stop the spend down, create access to LTSS for the middle class. And UDW's logo is right next to that. Now, thank you so much, Amanda. We're going to move to our next panelist, Monique Harris, who is representing Hand in Hand, the Domestic Employers Network, another really incredible partner with the grassroots work related to CADA and this effort. And so I'm going to pass it over to Monique, and Lindsay is going to be revoicing. So I will pass it along to you all, and then I hope as everyone is sharing, all of the attendees, all of you are thinking about questions. so that we can have a dialogue after Monique and then Eli shares. Thank you.
Hello. And we believe that we have more to give and can get much more done with this bill and senior. And the board community join together to the common goal that we have for affordable LTS and that has fair accommodation for workers.
Hello. At Hand in Hand, we believe that we have more to gain and can get much more done when people with disabilities, seniors, and unions in the broader worker community join together towards the common goals that we have for affordable LTSS that has fair conditions for workers.
No. Even politicians, so we all terrible and our union.
When we don't let politicians divide us, we are more powerful in our unity.
For example, in 2014, when seniors and disability group joined WSSEI, with the same demands, voices, and push that against government welcomes and IHSS working out and 2016, the California University working college with the support of seniors and disability UDW and other organizations of community to overcome that for domestic work and immigration and sexual exclusion.
So for example, in 2014, when senior and disability groups joined UDW and SEIU with the same demand, we were successful in pushing back against Governor Brown's cap on IHSS worker hours. And in 2016, the California Domestic Workers Coalition, with the support of senior and disability groups, UDW, and other organizations, won the permanent right to overtime pay for private pay domestic workers, ending a racist and sexist exclusion.
There will be those who will say that working rights and welfare can only have an endorsement of some with disability and our family, or that we can only achieve point. Sketches of work and accessibility. LTS while keeping working wages low.
There will be those who will say that workers' rights and fair pay can only happen at the expense of seniors, people with disabilities, and our families, or that we can only achieve accessible and affordable LTSS by keeping workers' wages low.
This what we all deserve at LTS service. That benefit all of us. The workers that come and we can achieve it. We work together.
But we all deserve an LTSS system that benefits us all, the worker and the consumer, and we can achieve it when we work together.
That is why I am I have to be working in partnership with LTSS, so with everyone can have the engagement while working all the well and appreciate it. Thank you.
And that is why I am, in hand, is excited to be working in partnership for an LTSS system where everyone can have their needs met, while workers are paid well and treated fairly. Thank you. So what is being shown is a photo from, I believe, the 2014, at the time, Disability Capital Action Day. And it shows a lot of different kinds of people holding up signs and banners. In fact, Monique Harris, who's speaking right now, is in the left-hand corner and includes folks with disabilities, older adults, members of various organizations in the California Domestic Workers Coalition. It shows a banner from Senior Disability Action from San Francisco, Mujeres Unidas y Activas, and there's some different signs that have been written on, and one says, "Unity makes us stronger." And the other one says the same thing in Spanish, "La unión hace la fuerza." Thank you.
Thank you very much.
Thank you very much.
Thank you so much, Monique and Lindsay, for just kind of also grounding us that in order to find solutions to expanding long-term supports and services for our communities, we have to be working with all of those who have a stake in this, including the workers, and it's just, as a disability advocate and organizer, I'm just so excited for our continued effort to look at these issues in partnership, and because we really do depend on one another to have the kind of world that we want to see, which is one where all of us have the pay that we need to live the lives that we deserve, as well as the care and support and services that we all need. So with that, we are going to hear from Eli Gillardin now from the Marin Center for Independent Living, and through CFILC has been active with CADA in really, looking at CADA's approach to one piece of the puzzle that can help to provide more options, more LTSS options for Californians with disabilities and Californians who are aging. So I will pass it over to Eli now, who will walk us through those steps, and then we will launch into Q&A. Thank you.
Thank you, Allie. Hi, everyone. So my task is going to kind of give a deeper dive into the California Aging and Disability Alliance's policy framework. And essentially, the analogy I'm going to use is how we're going to build this brand spanking new, awesome, accessible, affordable home. So when you're starting to build a home, you need to start with the foundation. And the foundation of this home is SB 512, which is the bill that will create the framework for our new long-term service and support benefit. It's a 2-year bill. Currently, it's gone through the Senate and I believe is in the Assembly appropriations. And we are going to continue to advocate it to move through the Assembly and hopefully eventually get to the governor's desk. The bill essentially calls for a new LTSS program financed by a sustainable funding source. It includes establishing a 9-member committee that will provide ongoing advice and recommendations to the LTSS board until January 1st, 2025. This is what we're referring to as the LTSS Advisory Committee. Then, as this bill moves forward and as we develop, the foundation is solid, we're establishing the LTSS Benefits Board, which is going to be a 10-member board that will implement and oversee the new program and manage and invest revenue deposited into the trust. And this will be created in the state treasury upon appropriation and finance long-term services and supports for eligible individuals in this LTSS benefit trust. Now, these are a lot of, complex concepts that I have challenged wrapping my head around. But again, using the house building analysis, we need to start with the foundation. We need to understand what the cost of building this home is going to be, and that's the appropriations we've made for an actuarial study, which will determine exactly, what the scope of this LTSS benefit will look like. What is the age of eligibility, level of support it will provide based on activities of daily living. Will there be, essentially what is the determination process? And then what will, this cash benefit look like in terms of, daily benefit and the scope of LTSS services it will cover. And the LTSS Advisory Committee and then the LTSS Benefits Board will provide the foundation and oversight to craft this benefit and hopefully, as we all anticipate, it will be in place. I'd like to talk a little bit about the time frame. So 2019, 2020, the actuarial study will provide guidance on the benefits, eligibility criteria, program costs, and then the legislative proposal, SB 512, as we discussed, will create the framework for the program and implementation. Between 2021 and 2022, anticipated legislation will define the program and benefits and design of the departmental oversight, and we anticipated ongoing program design and financing. And then between 2023 and 2025, we anticipate to implement the program. Now, this is, a high-level overview, and there are a lot of elements that are going to drive both SB 512 and the actuarial study. But essentially, kind of using the housing analogy, we want to start with a solid foundation, understand our costs, and then use those two tools, which is the actuarial study and SB 512, to build the framing of our home, to build the roof, and eventually we'll have a brand spanking new, accessible, affordable home by 2025. So yeah, I think that covers it.
Thank you so much, Eli. This is Allie again. And I just want to also thank SEIU Local 2015 for these two slides that were created from them. So I want to give one of the CADA members a shout out. And Eli, thank you for guiding us through this framework that will help to create one of the many solutions that California needs in order to create more options for people with disabilities and older adults to afford and access long-term supports and services. So I know that there was a lot of information that was just shared, and what we hope, hand in hand, UDW and Disability Organizing Network, is that we can have, this can be just the beginning of understanding how the policy framework in Sacramento can connect to our lives on the ground, and how, in order to really figure out how we can have more access to what we need to hear from the experts on the ground, which are people with disabilities and older adults and workers who are living, you know, the current barriers and inequalities on a daily basis. So with that, we're going to open it up for Q&A, and so I'm going to pass it over to Megan to help logistically, and then the panelists will be answering the questions. And I will kind of determine what panelists may make the most sense for answering the question, but panelists, please feel free to chime in. And so let's get started. And then at the end, at about 1:45, 1:50, I will be able to share with all of you ways that you and your networks can plug in. Because the only way that we can create more options for all of us is by utilizing the power of our communities on the ground. So Megan, take it away.
Great. Thank you, Ali, and thank you to everyone that's been on our panel. Just a reminder, you guys can send questions to us through the Q&A box, through the chat feature, or you can also raise your hand, selecting the raise hand button, or dialing *9 if you'd like to verbalize a question. Our first question, I think, is for you, Ali. It says, "Hi, my name's Eric. I'm wondering if we'll receive a certificate of attendance for today's webinar."
Hi, Eric. Yeah, we can, no problem. I'm happy to, you know, develop a certificate for your attendance. If you could please, if you could, I'm just thinking on the fly here. If you want to email me, and anyone is welcome to email me, but particularly you, Eric, if you want to email me, ALLIE@cfilc.org. Thank you, Megan, for putting it in the chat box. And we can for sure get you a proof certificate that you attended this webinar. Thank you.
Perfect. We have a few questions regarding CADA. I know somebody asked how many members are in CADA. I'm going to go ahead and share that list in the chat. But we also have a question asking, can CBOs or organizations like an ILC become a member of CADA?
This is Ali. I will pass it over to Christina.
Hi, that's a great question, but I'm actually not sure about the answer. In reviewing the list of coalition partners, they are all statewide organizations that represent local entities. So I'm just not sure, but I can certainly find out and get that person back that information.
Thank you so much, Christina. I appreciate that. Yeah, I can make sure that that information, that we go back to CADA and determine that answer, and then we will get back to that person. Thank you.
Great. It looks like in our Q&A box, Caroline wants to know, what is the Senate bill again, and is it in California or federal?
I will pass it over to Eli.
Hi. So it's Senate Bill 512. It's in the California legislature, and I believe is currently over in the Assembly. So it's gone through the Senate. It's in the Assembly in appropriations. It's a 2-year bill. If you Google California Legislative Tracker, you can follow the process that the bill is taking. So I would check out that link as well.
Great, thank you, Eli and Allie. We have another question. It's about the graph that was on the UDW slide, and they want to know, it looks like from 2012 to 2013, there was a decrease in California's IHSS caseload. Do you know the reason for this decrease?
I do, yeah, this is Amanda from UDW. And I just checked in on this, and it's because, unfortunately, the states began requiring a letter from a doctor. So that certification meant that many people who had been eligible for IHSS and needed IHSS were then not able to get it. When we asked the state the reason for this, they said it was an anti-fraud policy. So needless to say, this is something that we're pushing back against and we don't agree with, but I wanted everyone to have the information.
Great, thank you, Amanda. And we have another question here from Brenda. Where will the money come from to fund these services?
This is Allie. I will pass it over to Amanda. Do you want to answer that? And then Eli, if there's anything else to add.
Well, we're lucky, this is Amanda from UDW. We're lucky that there was just a major victory in Washington State, which it was many years in the making, but it took 2 years in the legislature where they passed an LTSS benefit. Hawaii and Washington are the two states that have a benefit. And that in Washington State is funded with a payroll tax. We think to be successful, the benefit needs to be universal, which means it needs to be funded by everybody and eligible for everybody. Our eligibility needs to be open to everybody. So those are the principles that we're working with right now.
And Eli, would you like to add anything to that? Thank you, Amanda.
I think Amanda covered it. And, I would just, I guess the only thing I would add is, as part of the building of the house, that is something we have to determine. And, as we move forward, it might be one source of funding, it might be multiple sources. It'll also depend on cost, and that's why we want to really drill down and get solid data behind the actuarial study so it can inform us on what revenues will be required to support this.
Great, thank you guys. Our next question is, will age be a factor regarding eligibility to receive resources funded by the LTSS Benefits Trust?
This is Allie. Eli, do you want to elaborate on where we're at right now in relation to that question?
Sure, thank you, Allie. So great question. Currently we have a work group, the mechanics work group in CADA, who's kind of looking at the eligibility criteria and options for the actuarial study to look at. And yes, age is one of the components that is being looked at. So our activities of daily living, vesting period, and other components. And essentially, we won't know till the numbers come in. But we're looking at a variety of different options and what cost will be related to, let's call it the most generous plan versus one that's more narrow, and determine comparing costs across the spectrum between those two polar ends.
Great, thank you, Eli. Our next question here is, will these slides be available as a PDF after the webinar?
Thank you. This is Allie. Yes, we can make them available, and I will just have to make sure that all of the slides are accessible. So that may we may need into next week to send them out, but I will make sure that they are available. And in addition, this webinar will be archived on the Disability Organizing Network website. and so I hope that that you all can share this archived webinar with your networks when it is available, and I can make sure that a notice is sent to all attendees when the webinar is up and live in its archive form.
Great, thank you guys, and thanks for all the questions. We have quite a few more to get through. This one says, can you comment on the complications of IHSS for recipients with cognitive impairments, particularly ones who are isolated and or at high risk for abuse or neglect?
So this is Allie. I think, thank you so much. That is such an important question. I'm sure that we could probably spend hours and days talking about that. I'm wondering if Amanda would want to touch on that briefly, and then anyone else if you have additional comments.
Yes, this is Amanda from UDW. I'm a policy person for a union, so I don't have a lot of expertise in this question, but I will say in working on the policy committee for this effort that one of the ways that we've been looking at how the benefit would potentially operate is we've been looking at like, what is the IHSS standard around ADLs and IADLs? And we know that we need to increase services that are available around cognitive disabilities. So you can see in the list of organizations that are part of CADA, in particular the Alzheimer's Association, and a number of other groups have been bringing a high level of expertise to the conversation. So that's what I know I can say about it. Definitely still learning about how to address the issues that you're raising.
This is Christina. This is certainly a very critical and important topic, and it's coming up in a variety of different venues recently. If you're not aware or a part of the Silence Equals Violence Network, a coalition of both state and nonprofit organizations working on subjects like abuse and neglect, I would encourage you to join, and you're welcome to reach out to myself to get information about that. Those meetings are held at CFILC at our office in Sacramento quarterly, and we are one of the partners among many others at that table. The other thing that I think that some of us should consider exploring around this topic is how are we holding the managed care organizations accountable for some additional supports and services they might be able to provide, or frankly should be providing in partnership and collaboration with those in the community that are providing or know how to provide services to those with cognitive or intellectual or developmental disabilities that need this level of service and self-management type coordinated care. I would certainly like to see that be something of discussion by the state, possibly when the next managed care organization RFP goes out. But again, you're welcome to contact me if you want to learn more about Silence Equals Violence as well.
Thank you, Christina. This is Allie again, and I just want to add, first of all, just for acronyms, RFP stands for Request for Proposals. And I know that, and if there's any other acronyms that we've said, please type in the chat box, let us know so that we can make sure that we're all on the same page. In terms of raising kind of the particular communities that have been mentioned, including the intellectual and developmental disabilities community, it is so essential that as we elevate the stories of people on the ground experiencing inequalities related to LTSS, that we hear from our community members with all kinds of different disabilities, including intellectual and developmental disabilities. And so I'm really excited for, in addition to the Alzheimer's Association that is a member of CADA, we also have the ARC of California, which is also a member. And so with the grassroots work that we want to invite all of you into, I really want to encourage us to think about who are the people in our lives, who are the leaders who, and the everyday folks who live with different disabilities, who use LTSS or need more access to it, and that, and that those individuals, how can we support them in sharing their stories so that those decision makers and entities that can help to create solutions that they can be told our truths, so that our truths can then inform how this benefit and other services that exist truly can support our community. Back to you, Megan.
Great, thank you guys. So our next question is, can you share the statistics of how many years do most people need LTSS?
Ali, I can answer that. This is Amanda. Is that okay?
Please go for it. Thanks, Amanda.
That question is very broad, but I'll answer for the aging community. For older adults, the statistics is most people, more than 75% of people, will need access to at least 1 year of home care at the end of their lives. So that's the most sort of universal statistic that we use around aging. There are many, many statistics for the other communities that are part of the CADA effort. So I'll go back to Ali and see if anyone else has any to add.
Thanks, Amanda. Christina, would you like to go ahead and share a little bit? I know I have thoughts from the community organizing perspective, but Christina or Monique or Eli, as it pertains to the disability community?
This is Christina. I'd love to give Monique an opportunity to reflect on that. And while she's putting together thoughts, maybe Ali, you could give your organizing perspective on it.
Sure. So my answer to that, I think it depends on so the question again was what's the average number of years, I believe. Was that correct, Megan, that people need LTSS?
Yes, that's correct.
Okay. So I think for people with disabilities, it depends on the type of disability, but for people who have their disabilities from birth, they could need LTSS every day for their whole life. I can speak for myself as someone who needs a wheelchair, so I need durable medical equipment. I also, for a number of years, have needed long-term mental health care, and those are LTSS services that I need. So, for instance, durable medical equipment has been something I've needed all my life, and then for my mental health care that's been long-term, it has been, for the past 12 years. So I think with that being said, as we think about from a community organizing perspective, it is so essential that we get the spectrum of stories about not only what LTSS is, but also the different kinds of LTSS and the levels of time, the different time lengths that people use them, which is again why the grassroots efforts that we are doing and about to really full-on launch through CADA and through our organizations, it's the diverse stories of LTSS that will paint the picture of how LTSS is used for kids up until, and then for their whole lives. It could happen in middle age with acquiring disabilities, or it could be the last few years of people's lives, like Amanda shared around our aging communities. So Monique and anyone else, but Monique, do you have any thoughts that you would like to share?
Yes.
Yes, Lindsay's going to say what I said. So we were just talking in the room here while you were talking and agree with what we've heard. But Monique wanted to add, just from her personal experience, that her mother needs support in the home and is going to live and need it a lot longer than just 1 year.
She got cancer.
Because she has cancer.
Other friends got cancer and they didn't need attendant care.
And she has other friends who have cancer who need attendant care.
So, yeah.
So similar to what you were saying, Allie, it really is going to vary based upon different individuals. Thanks.
This is Eli. I would just add a couple things, which is I think one of the real values and dynamic components of exploring this long-term service and support benefit and the work that CADA, California Aging and Disability Alliance, has embarked on is that it's giving the aging and disability and workforce communities an opportunity to define or redefine these very kind of complex and broad topics. What does long-term services and supports mean? What are activities of daily living? You know, traditionally we think of activities of daily living as, you know, those basic domestic activities like eating, bathing, dressing, toileting, and so on, that support you in the home. But, you know, when we talk about community activities of daily living, we're going outside the home. You know, what does it take to pursue and maintain employment or vocational training, arranging and accessing public transportation, keeping and following through on your healthcare appointments, participating in, you know, social activities. I think some of the dynamic and what I find really exciting components of this work is that it's allowing us to have these broader discussions on, you know, defining not just what this benefit will ultimately look like, but what are we talking about when we say long-term services and support or activities of daily living?
Thank you so much, Eli and Monique and everyone who's shared. Back to you, Megan.
Great, thank you, Allie. We have a question here. It says, is loneliness part of the current LTSS services? And if not, is there a plan to include it?
This is Allie. I thank you so much for that question. I definitely have some thoughts, but I would like to throw it out to any of the panelists who would like to answer a piece of that question. Is loneliness part of the current LTSS services? And if not, is there a plan to include it?
This is Christina from CFILC. I haven't heard this specific topic come up under LTSS and our SB 512 conversations, but that's not to say that it's not relevant and could be. I just don't think we're at a point yet of determining how it would be covered and in what mechanism. What I will say though is it is certainly coming up repeatedly in the discussion around the master plan and how the master plan will create opportunities to decrease isolation and loneliness. And as a member of the California Collaborative Master Plan Work Group member, this is something that we've spent some time talking about and what we're going to be asking of the master plan advisory committee that the administration is putting together. So thank you for bringing that question up, and it's certainly coming up in other other conversations, but not necessarily in the 512 conversation quite yet.
Yeah, this is Eli. I would just add that, you know, if you look at some of the components of personal assistance or adult day health center services, there are LTSS, you know, community-based organizations and programs that really do touch on social isolation and the social determinants of health. Independent living centers, another one, obviously. So while, you know, we're in the early stages, again, of kind of building, you know, this house and this foundation, I think looking at all of the social determinants of health and what it takes to support people in living safely and high-quality lives in the community, definitely social isolation is a touch point across many of the LTSS services and you know, and intervention.
I just want to quickly add, but Eli said it, if you're not familiar with your local independent living center, I would encourage you to touch bases with them for their peer support services. And you might also find out during that meeting and process from your peers in that area what other services might be available to help prevent or limit loneliness and isolation. And there's a lot of other services, you know, community by community, it's a little bit different, and eligibility might be a factor as well. But I think if you are in touch with your local ILC, they will also be able to provide you some additional resources in that area.
Thank you so much. And I just, anyone else, Monique, did you want to also speak to this at all? If not, feel free to, okay. It says, no, Monique doesn't have anything to add. All right, well, let's see if we have any other, I actually also see a comment here that I wanted to speak to that, you know, that regarding the question around loneliness. I've heard this individual has said, I've heard so many folks, so many Meals on Wheels folks say that the visit is just as, if not more, needed than the meal. And I think that when we, from the policy level down to the grassroots, when we think about LTSS, it may not be explicitly to meet the need of loneliness, but for example, having access to Meals on Wheels or having access to durable medical equipment or home modifications, that creates a door to then have more access to community living, which inherently means more access to connection, to relationship building. So I just wanted to also share that piece. And then let's take one more question, Megan, and then we'll move to how folks can get involved.
Great, thank you. Our last question here comes from David, and he wants to know, are spousal impoverishment rules that allow IHSS applicants income and resources to be allocated to a community spouse so that the IHSS applicant can meet income and resource requirements still in effect? I heard there might be a sunset date.
This is Allie. Amanda, are you able to touch on that?
Amanda from UDW. That I'm working on federally. We're working on the spousal retirement eligibility issues around the IHSS program for family caregivers. But I can have Megan, if you don't mind, if you could just email me that question and I could get the answer for you on it. Thank you for that question.
All right. Thank you so much. And I am just going to make sure that Everyone can see, okay. So we are already almost at 2 o'clock, which means that I want to thank each and every one of you for joining us today, and for our panelists, Christina Mills, Monique Harris, Amanda Ream, and Eli Gillardin, and of course Megan for facilitating the logistics of Zoom, and of course our captioner. Access is essential to all of the activities that we do. So now what? We're here today because we wanted to connect you to the policy. We wanted to connect the policy to the grassroots, because the real change that we want to see in the world has to happen with us. So what now? We need each other. We need our stories, our relationships with other people with disabilities or folks living with chronic illnesses, however you identify, folks who are aging. And then we need our collective, our communities. So the Grassroots Committee of the California Aging and Disability Alliance, UDW, Disability Organizing Network, and Hand in Hand and Caring Across Generations, and some of our other partners, we are launching a campaign that is really to elevate the stories of LTSS and the inequalities that exist, so that we can educate and inform the media, our policymakers, decision makers around the state. And so there's a few ways that you can do that. One way is we need our stories. We need LTSS stories, whether it be your own story or someone you care about who has had to either spend down, spend all of their money in order to be on Medi-Cal to access what you need, or that you are, deeply struggling right now to afford the access, to afford and access LTSS that you need. There's different stories that we need to elevate around the state, and we'd like you to join us. The other way that you can get involved, which connects to storytelling, is we will be hosting a series of long-term supports and services for expanding LTSS for all town halls around the state. There will be 2 in September and more down the line. Everyone who is on this, who has joined us today, you will receive an email with the details of these town halls. The first one will be on September 16th in Valley Village, California, in the San Fernando Valley, and after that, on September 19th, will be a LTSS town hall in San Francisco. I also wanted to say that we are launching this element of the campaign to create more options for LTSS, and we are calling it the CARE Agenda, Expanding LTSS for All. And the CARE Agenda, I just wanted to speak to for the last minute or two. As we look at this name, the CARE Agenda, Expanding LTSS for All, we want to redefine and take power over what we mean when we say care. We are talking about a campaign that we want to invite every single Californian, policymaker or not, to care about the essential need for affordable and accessible long-term supports and services for aging and disability communities, and to ensure that we do this alongside our workers and union communities, because the reality is that in order to create solutions that can create more community living options for all of us, we need all of us at the table. And so please, we invite you to join us in the CARE agenda, expanding long-term supports and services for all. Your stories, your connections, and your participation is essential. So again, thank you so much. And let this just be the beginning.